Dan from Jump Bag EMT. Thanks for liking and subscribing. Do it now if you haven't done it yet. In less than 5 minutes, we're gonna knock out some of these acronyms that are gonna set you apart in EMT school. They're gonna get in that old dome there and you're just gonna be ready. You're gonna be rocking and rolling through school. So without further ado, some of the most important acronyms you need for EMT school and in the field. And we're gonna start with the ABCs. Why not start in the beginning, right? And this is airway, breathing, and circulation. This is huge for almost everything you do because this is gonna help you get the appropriate order of events that's going to keep these people alive. So when you show up on scene, you're looking at patients, you're looking at airway, breathing, and circulation right off the bat. So A, B, C. You're going to hear this all the time throughout school. Learn it now. All right, next, we're going to go right into our vital signs. These are some of the things that you're going to write down on every patient because it's going to help us trend, right? How are they doing now and how are they doing later? Are they getting better? Are they getting worse? And these are some of the ones you're going to look at. We're looking at PR. This is going to be your pulse rate. This is how fast that old ticker is moving, how fast that heart is moving. Next, we got respiratory rate, and this is how fast they're breathing. Normal respiratory rate is 12 to 20 in adults, so if it's less than that, you know it's low or hypo. If it's above 20, you know it's faster, so it's hyper, right? So respiratory rate, RR, it's gonna be that shorthand. Next, BP, pretty simple, blood pressure. This is systolic over diastolic. Systolic is under pressure when your heart beats and sends blood downrange. And diastolic is when those arteries and veins are at rest. So BP is your blood pressure. Next, SpO₂. This stands for your oxygen saturation. And what this means, this SpO₂, means how much of your red blood cells are actually bound, or your hemoglobin is actually bound with oxygen. How much oxygen is your blood actually carrying? And this is going to come out as a percentage. And you've seen it on TV. You probably even had it done where it goes on your finger and there's that little flashing light. That is measuring your oxygen saturation. That is huge for our vital signs. This is going to let us know whether you got oxygen on board or not. All right, and last, we're looking at end-tidal CO2 or etCO₂. Now, not every agency is using this, but this is huge coming up in the industry because the byproduct of breathing is carbon dioxide or CO2. So we're not releasing CO2 unless oxygen is getting in and there's a gas exchange taking place. And that's breathing, folks. It's not just moving air in and out, because you can ventilate, you can move air in a state, right? But if the gas exchange isn't happening, it's not breathing. So this end-tidal CO2 is right now. What waste product is being released right now? And this is your end-tidal CO2. So ABCs, airway, breathing, and circulation, going into our vital signs. PR, pulse rate. RR, respiratory rate. BP, blood pressure. SpO₂, your oxygen saturation. And your end-tidal CO2 or etCO₂. Take a look, get the note cards out, write them down, and we're gonna be back with some more. Learn these early, and school is gonna be different for you. Thanks for watching, like and subscribe.